Hello everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. A quick note whether the audio visual is all good. Let me just check the live chat. All right, I believe you can see me and hear me as well. So here we are in the Biochemistry Mega Revision, where we would try to revise all the important points and the must-know points in biochemistry. And this is the first part itself. This is the part 1 itself that we are doing here today, right? Okay. And apart from that, we have a few other free live classes also going on. So on the Unacademy app at 6 p.m. starting today, we have planned for 3 classes. So 6 p.m. today we had the class on physiology, graphs and few numericals. Tomorrow 6 p.m. We will have a class on PSM numericals, basically telling you the tricks on how to solve the questions fast, and the mnemonics to remember the various, the p-value, sensitivity, specificity, all of that. And on 26, it would be basically pre and paraclinical subjects, the clinical way. There would be KBMD of that. So clinical questions of first and second year. Second year subjects is what we are going to do. I've shared the links on the Telegram group already. We will have part 2 of the Biochemistry Mega Revision tomorrow at 9:30 p.m. Okay. Yes, thank you so much. All these classes are planned because based on the feedback, the inputs that I've received from majority of you. So thank you, Kay, and everyone else here. A quick update on what's happening on the platform. So the unlock is back. You have now 20% off available on medical PG subscriptions. FMG students can take for the FMG mastery course. We have for the next students as well. And you have the code Dr. Nikita for the 20% off. You also have now the Sure Shot 150 available at a very, very reasonable price of 1600 with the credits that you have on the app. You can get it for as low as 1200. So this is till 28 February. We have this ongoing offer. In the Aspire Next 2023 batch, basically it's a 9 months course. We are starting on February 28. We have really good educators to cater to your subjects. It's gonna cover the theory, the MCQs, the clinical MCQs and everything. For the current exam going students, we have the final booster batch, a 1 month rapid revision course now available at 4K. So pre-YQs, most expected questions, BTR is available in this final booster batch. And for the FMG students, we have started the batch on February 10. By April, we would be finishing the theory, and then in the rest of the 2 months, we would be focusing on the MCQ practice, right? So let us start with the first one. So I'll be first starting with the topic of amino acids because this is very, very important. And first we'll do the structure part of it, then the amino acid disorders. Expect one question from that, right? So amino acid special groups. So I'll be quickly telling you everything because there are so many things to be revised. So we'll go a bit fast. You can always come back to this video later and you can revise as well later on as well. Okay. So remember that guanidinium group, guanidinium G for G is present in arginine. Benzene group is present in phenylalanine. When I say phenyl, we know that it has that benzene ring. And tyrosine has a phenol group. Okay, fine. Tyrosine has a phenol group. Histidine is imidazole. So remember it is high. High means histidine has imidazole group. Proline is pyrrolidine, rhyming proline and pyrrolidine. Methionine, thio is the thioether linkage. and tryptophan has a indole group. So remember, this tryptophan is like the tricolor flag of India. So India is indole and this is tryptophan. So remember, tryptophan has indole group, and also remember that tryptophan try for vitamin B3. It forms vitamin B3. 60 milligram of tryptophan forms 1 milligram of niacin. Right, so that is why whenever there's going to be tryptophan deficiency, there's going to be niacin deficiency, like you have in conditions like Hartnups, carcinoid, where all the tryptophan is going towards serotonin. Okay, next one. So which amino acids are most acidic and which are the most basic? So thinking logically, acidic मतलब जिनके नाम में acid है वो रहेंगे acidic. Aspartic acid, glutamic acid are acidic. Aspartic acid AA is very acidic. Okay, and the next that we have is basic. Basic basically means alkali. You can remember it as halkali. Halkali is HAL. So we have histidine, arginine and lysine, which are the most basic. Arginine is the most basic. So remember that AA are the ones which are the most acidic and most basic. So if I tell you which is the most acidic, aspartic acid. Which is the most basic, again A for arginine. Okay, A for arginine. So remember, halkali is alkaline, that is histidine, arginine and lysine are alkaline, that is basic. Now, which are the essential amino acids and which are the non-essential amino acids? For the essential amino acids, we have private Tim Hall. Okay, few queries here. What is the duration of this particular class? This is going to be around 50 minutes, 1 hour class, part 1. Next will be part 2 tomorrow. Is this enough for the last minute revision? I would not say कि this is enough कि सब कुछ इसमें से ही आएगा, but this is the core. This is like must know. You cannot go to the exam hall without knowing this. I hope this answers all the queries that I've been getting here in the live chat. Okay. So private Tim Hall is the essential amino acids. P for phenylalanine, valine, and remember T is threonine. Okay, T is threonine, it is not tyrosine. I'm really sorry, Videsh, could not share the PDF before the class. Should have done it, but I forgot. I'll do it after the class is over. Okay, then you have T for tryptophan, isoleucine, methionine, histidine, arginine, and leucine and lysine. Some books also put H and A. It is into semi-essential. So you can remember, it comes as a surprise. These are not essential. These are like semi-essential. So arginine and histidine, some books put it into semi-essential. Now, the next one that we have is, so essential and semi-essential we know now. Now tell me that which are the amino acids which are both glucogenic and ketogenic. Amino acids which are both glucogenic and ketogenic are, remember this is a tip to remember that which are both glucogenic and ketogenic. It is TIP. What does TIP stand for? Tryptophan, isoleucine, phenylalanine, and the other T for tyrosine. So basically all the aromatic amino acids, phenylalanine, tryptophan, tyrosine, and isoleucine. You can remember that isoleucine, iso matlab acting or present in iso form, that is two forms, that is glucogenic and ketogenic. So remember, aromatic amino acids plus isoleucine, these are both glucogenic and ketogenic. Also remember that which are the amino acids which absorb the ultraviolet light, those are the aromatic amino acids. Phenylalanine, tyrosine, tryptophan. Maximum is with tryptophan. Okay, maximum is with tryptophan. This is a previously asked question, that if you replace alanine with which amino acid, then there will be light absorption at 280 nanometers. That is tryptophan. Next one, which are the pure ketogenic amino acids? Remember L and L. Okay, L and L. Then what do we have is ketogenic. K ke baad aata hai L. So remember, ketogenic is leucine and lysine, and all the rest of them, they go into glucogenic. So remember which is ketogenic, remember which is both. If not any of that, then that amino acid is glucogenic. Then that amino acid is glucogenic. Okay. Now going to which are the branched chain amino acids. Which are the branched chain amino acids? Remember a tree which is branching, right? A tree which is branching. Which is that tree? This is a maple tree which has the branches, right? So why am I telling you maple tree? Because the defect in the branch chain amino acid metabolism leads to maple syrup urine disease. When do we branch out into the multiple generations, right? We branch out into multiple generations when we are live, when we live, when we are live. So remember LIV. What is LIV? LIV is leucine, isoleucine and valine. Remember, L is not for lysine. Okay, L is not for lysine. So when I say isoleucine, uske similar naam wala is leucine. It is not lysine. It is not lysine, right? Out of that, we saw that isoleucine is both glucogenic, ketogenic. Leucine is only ketogenic and valine is glucogenic, right? So you can also be asked a question like, which of these is a branch chain amino acid and is both glucogenic and ketogenic? You have the options. Remember, it is isoleucine. Okay, it is isoleucine. So maple syrup urine disease is the defect in branch chain keto acid dehydrogenase. 1, 2, 3, 4 letters. 1, 2, 3, 4 letters wala enzyme. MSUD is BCKD. And remember that what vitamin supplementation can help in MSUD? It is vitamin B1. Thiamine is a very important part of BCKD. This BCKD requires what other vitamins? 1 plus 2, 3, 2 plus 3, 5. 1 plus 2, 3, 2 plus 3, 5. Vitamin B1, B2, B3, B5 and it requires lipoic acid. Okay, so vitamin B1 supplementation is what we give. Next we have is enzymes. What are the various enzymes defective in the various amino acid disorders? So what do we have? Phenylketonuria, as the term says, it is phenylalanine hydroxylase. Phenylalanine hydroxylase deficiency. Tyrosinemia type 1, which is tyrosinosis. Remember, one is first. First is fumarate acetoacetate hydrolase, that is FAAH. Maple syrup, maple tree, it is branching, branch chain alpha keto acid dehydrogenase. Alkaptonuria is homogentisate oxidase. Okay, homogentisate oxidase. Alkaptonuria is a defect in which amino acid metabolism? Alkaptonuria is a defect in tyrosine metabolism. Okay, it's a defect in tyrosine metabolism. Albinism again is tyrosinase because melanin comes from tyrosine. Homocystinuria type 1, that's a classical one. So remember that homocysteine is cystathionine synthase, which is what vitamin dependent? Homocysteine is like homocysteine. So remember, it is vitamin B6. This is dependent on vitamin B6. Homocystinuria type 2 is the other one, that is B12 deficiency. Then you have tyrosinemia type 2, which is Richner-Hanat syndrome. 2 has two words, Richner-Hanat, and remember 2 for T and the enzyme is TAT, that is tyrosine aminotransferase or tyrosine transaminase. Tyrosine aminotransferase. Okay, and when in which amino acid metabolism defect do we see hyperoxaluria? Remember glyoxylate, that is basically glycine. ग्लाइसिन के मेटाबॉलिज्म डिफेक्ट में हाइपरऑक्सालूरिया होता है. ओके, रिमेंबर दैट. Now, what are the tyrosinemia types? You have type 1, type 2, type 3, and you have here Hawkinsuria. Type 1 is tyrosinosis. This is the one which is called as hepatorenal. This is the one which increases the risk of HCC. And F for first, FAAH is the enzyme. Tyrosinemia type 2, that is Richner-Hanat syndrome, is that. This is what we already saw. This has oculocutaneous involvement. And which is the neonatal tyrosinemia? That is tyrosinemia type 3, which can be seen as a benign condition in the newborn because of the functional, the function is less developed in the newborns for the enzyme 4-HPPD, hydroxyphenylpyruvate dioxygenase. So remember in type 3 के बाद आता है 4, it is 4-HPPD which is defective. If it is a mutation in the gene for HPPD, remember H for H, then it leads to Hawkinsuria. Okay, then it leads to Hawkinsuria. So remember, 1 is first, FAAH, 2 is TAT, 3 is 4HPPD. 1 is the one which is the most severe, and it has what odor? It has cabbage odor. It increases the risk of HCC. Remember, cab, tire. That means cabbage odor is seen in Tyrosinemia, and from the tire fumes are coming out. That means Tyrosinemia forms fumarate as the product. You have fumaryl acetoacetate hydrolase. Next one, looking at the urine odor. Urine odor में maple syrup means maple syrup होगा. Remember, syrup is the sugar. That means it has burnt sugar odor. Okay, it has burnt sugar odor, which is also called as caramelized sugar. It means the same thing. Syrup contains sugar. So maple syrup is burnt sugar. Hawkins. Remember, hawk is a bird who is swimming in the swimming pool. So Hawkins is swimming pool. Then you have sweaty feet. Sweaty feet is isovaleric. When I write isovaleric, remember the SV is the sweaty feet. Cabbage is Tyrosinemia. Tire के cab में से fumes निकलना. Multiple carboxylase deficiency. This is the MCA. This is tomcat urine. So remember, tomcat urine is multiple carboxylase deficiency. Phenylketonuria, trimethylaminuria. Methylamine phenylketonuria. Phenyl is like F. F is for M. M is for F. Phenylketonuria is mousy odor. Methylamine is fishy odor. This is a previously asked question in one of the recent FMGE exams. Okay, so remember, methylamine is rotting fish. These are the ones that we have already covered here. The odor in the various odor in the various amino acid disorders. Next one, homocystinuria is something which is very, very important, and remember few points about homocystinuria. Clinical features are, this patient habitus is similar to Marfan's. That means this is a tall patient with the long fingers. And what else do we have? The keywords are early age MI, early age stroke, because homocystinuria is like a pro-atherosclerotic condition. Okay, it fastens the atherosclerosis. Like Marfan's, this also has the lens subluxation. But where do you have the lens subluxation in homocystinuria? It is opposite of Marfan's. Where do you have in Marfan's? Remember, Marfan's is like Marfan. Fan is present up in the ceiling, and we say everybody fan out. So in Marfan, it is up and out. So in homocystinuria, it is down and in. So it is down and in. That means it is inferomedial. Okay, that means it is inferomedial. Inferonasal is what you should remember. Right? So, and here the IQ also can be affected in homocystinuria. So, few questions on homocystinuria. Homocystinuria is formed from which amino acid? Homocystinuria, this is basically a reversible reaction that is present here. Methionine forms homocysteine, homocysteine forms methionine. So remember, homocysteine is formed from methionine. Next, once the homocysteine is formed, either it can go to form methionine, back to methionine, or it can go ahead and it can form cysteine, right? So remember, it is MHC, like your major histocompatibility complex. H can form M, H can form C. That means it can form methionine or it can form cysteine. And to form the cysteine, this is vitamin B6 dependent. So homocysteine is basically homocysteine getting converted to cysteine, that is again like 16. This requires vitamin B6. Okay, requires vitamin B6. So cystathionine synthase is vitamin B6. Right. So when there is homocystinuria, this step is blocked, and that is why homocysteine gets elevated. So therefore, if you get a question that in homocystinuria, what should be supplemented and what should be stopped? Remember that cysteine nahi ban raha hai, isliye cysteine supplementation needs to be given. Methionine should be restricted because methionine forms homocysteine. We do not want more homocysteine. So restrict methionine, give cysteine in homocystinuria. Okay. And for the conversion of homocysteine to methionine, methionine is like methyl cobalamine. So this requires methyl cobalamine. That means vitamin B12 and vitamin B12. No, Bhakti, the post test is at 10:30, I believe, right? It's not 10. I'm sorry. Okay, so what do you need to remember is vitamin B12 is required for conversion of homocysteine to methionine, methyl cobalamine, and B12 and B9, that is B12 and folic acid, are very interrelated, right? So remember, this is B9 and B12. So what vitamin deficiencies basically can lead to homocystinuria? Remember the multiples of 3 but not starting with 3. That is 6, 9, 12. Vitamin B6, vitamin B9, vitamin B12 but not vitamin B3. Niacin deficiency will not cause homocystinuria. Okay, 6, 9, 12. 6 is the classical one. Okay, 6 is the classical one if you have to choose one. So homocystinuria, intellectual disability, stroke, MI, marfanoid habitus, lens subluxation, which is inferomedial, kyphosis, skeletal formation, deformities, and osteoporosis. Decrease methionine, increase cysteine. You have B6, B9, and B12 supplementation is what we need. Okay, and this is what is given here basically. Okay. Next one, let's go to phenylalanine metabolism now. Phenylalanine, it forms tyrosine by phenylalanine hydroxylase. So that is why when this enzyme is deficient, this leads to phenylketonuria. So there would be phenylbutyrate, phenylactate that would be formed, and so there will be phenylketone which will increase, which gives the mousy odor or the musty odor. Okay, it gives the mousy or the musty odor. What are the clinical features in phenylketonuria? Remember that the clinical features are blonde hair is a feature given with mental retardation. IQ is decreased. Okay. Another question, if the mother has phenylketonuria during pregnancy, that means what is the teratogenic effect on the child? It can lead to microcephaly. Okay. It can lead to microcephaly. Next one that we have, what is the other thing that this phenylalanine hydroxylase requires? It is tetrahydrobiopterin, that is BH4. Tetrahydro, B for biopterin is required. Okay, so remember that can lead to non-classical phenylketonuria. So tyrosine pe aa gaye, abhi tyrosine. So what amino acid becomes essential in phenylketonuria? It is tyrosine. Normally, tyrosine can be formed in the body from phenylalanine, but if there is a deficiency at this step, tyrosine will not be formed, so tyrosine will become essential. Okay? Next one that we have is tyrosine goes ahead and forms DOPA. DOPA forms dopamine, norepinephrine, epinephrine. So basically the catecholamines, all of these are formed from tyrosine. You can remember this as tyrosine sounds similar to thyroxine. So when thyroxine is increased in the body, hyperthyroidism, we know that there is a lot of catecholamine wala reaction, sensitivity there. So remember that thyroxine and catecholamines go together and both of them are formed from tyrosine. So tyrosine by tyrosine hydroxylase forms DOPA. Even this tyrosine hydroxylase requires tetrahydrobiopterin. So all the three aromatic amino acids hydroxylase, phenylalanine hydroxylase, tyrosine hydroxylase, tryptophan hydroxylase, and you have nitric oxide synthase. These require tetrahydrobiopterin. Okay? And what is the reaction which basically converts a norepinephrine to epinephrine? It is the methyl transferase, that is methylation. So remember that norepinephrine has no methyl group. When you add a methyl group, then it becomes epinephrine. Which is the methyl donor in the body? It is S-adenosyl methionine, that is SAM. You can see that methionine here is forming homocysteine, S-adenosyl homocysteine. So methionine is forming homocysteine. Okay. Dopamine forms norepinephrine by hydroxylase, dopamine hydroxylase. What vitamin is required for hydroxylases? Hydroxy is water. Where is the water present? Water is present in the sea. So remember, this requires vitamin C, hydroxylation. Dopa forms dopamine by dopa decarboxylase. So always remember this point, that whenever an amino acid is forming an amino acid forming an amine, that means you are removing the acid group. So it is decarboxylation reaction. This requires vitamin B6. Okay, this requires vitamin B6. Decarboxylase requires vitamin B6. Okay. So now going to the next one. So phenylalanine, tyrosine, this can lead to phenylketonuria if this is stopped. Tyrosine forms dopa. From dopa you have melanin also by the action of tyrosinase. So albinism is tyrosine deficiency. Remember, albinism, melanin is formed from tyrosine. So it is albinism from tyrosinase. Dopa to dopamine, we said it is vitamin B6. Dopamine to norepinephrine, vitamin C. Hydroxylase, this is methylation, this is SAM. Even homogentisic acid comes from tyrosine, that is why alkaptonuria. Homogentisate oxidase deficiency is tyrosine deficiency. Key word for alkaptonuria, remember alka, just rearrange that. It is alka is kala. So you get kala urine on standing, black urine on standing with alkaptonuria, with pigmentation of the cartilage, with ochronosis, and the patient is at risk of developing arthropathies, early age arthropathies with alkaptonuria. Remember, it is autosomal recessive. Majority of these amino acid disorders are autosomal recessive. Okay, they are autosomal recessive, right? Going on to the next one, this we have already seen, phenylketonuria. So decrease phenylalanine because it is not getting metabolized, so no need of giving that. Increase the tyrosine in the diet, give BH4 supplementation. Fair complexion, mousy odor, intellectual disability is what we see. The phenylketones will increase in the urine. Okay. Next one. This is what you are seeing here. The same thing has been shown here. Remember that tyrosine forms fumarate and acetoacetate. Tyrosinemia types we have already seen. Going to amino acid products. Amino acid products, quickly revising. This is the same thing which is given here. This we have already seen. Melanin and thyroxine is also from tyrosine. Remember that. What does tryptophan form? Trypto is trypto. Tri is vitamin B3. And trypto is TO, serotonin and melatonin. Okay, remember not melanin. Melanin is from tyrosine, right? Absolutely right. Tyre is black in color. So remember, black is melanin. Serotonin, melatonin comes from tryptophan. Histidine forms carnosine. Histamine is from histidine. By which reaction? You are forming the amine. So this is decarboxylation. Okay. Glycine is required for a lot of things. Most important, remember, it's required for heme synthesis and many other things is where we would see that. And glutamate is G for G GABA, glutathione. Okay, glutathione also requires glutamate. Very, very important. You'll see this question very frequently in the exam. Nitric oxide synthesis requires arginine. That is nitric oxide. Okay, nitric oxide. Arginine is required for urea also and creatine also. Okay, urea and creatine also. So remember that if you get a question that arginine is required for synthesis of creatine, urea, nitric oxide, all of the above, remember it is all of the above. Okay, do not be in a hurry to mark the answer ki arginine hai nitric oxide. Always check the last option if you have all of the above. Okay. Going on to the next one. So a quick revision of the products. Melanin is from tyrosine. Melatonin is tryptophan. T3, T4, thyroxine is again tyrosine. Histamine is from histidine. GABA is from glutamate. B3, tryptophan. Creatine requires what all amino acids? Always try to create magnificent results. Mag are the amino acids required. So you have methionine, arginine and glycine. What are the three amino acids? Methionine, arginine and glycine are required. Then serotonin is tryptophan, catecholamines, thyroxine wala, that means it comes from tyrosine. Okay, it comes from tyrosine. The next one, creatine synthesis. What are the steps in creatine synthesis? Where does it occur? First step is in the muscle, in the liver or in the kidney? First step is in the muscle, kidney or liver. Where is the first step for creatine synthesis? It's in the liver. Everybody is saying liver. The steps of creatinine synthesis, the first step is in the kidney, then in the liver and then in the muscle. Easy to remember, alphabetically remember HIJKLM. So kidney, liver, muscle. So first it starts with the kidney. The first thing to form in the kidney is what is getting formed is guanidinoacetate. Guanidinium containing amino acid was arginine. So this requires arginine and glycine. Okay. So guanidinoacetate बना, फिर creatine आएगा, methionine लग रहा है यहाँ पे, methyl transferase, and then creatine forms a creatinine. Okay, creatine forms creatinine. Okay, so remember it is KLM is what you need to remember. So look at the amino acids required for creatine. You have arginine, glycine and methionine. That is MAG result. Okay, that is MAG result. Next one, what do we have is glutathione. Glutathione, what does glutathione require? What does the glutathione require? Which amino acids? Remember, glutathione is 3, that is G, C, G. Glutamate, glutamic acid is required. Thio containing, cysteine is a sulfhydryl group containing, thio containing, and again you have glycine here. Okay, again you have glycine here. So look at this one. This is glycine, cysteine and glutamate. That is GCG, that is for glutathione. And which is the most functional, the most active amino acid here for reduced glutathione? The one which contains the sulfhydryl group. Reduced glutathione is the cysteine wala. Cysteine wala is the most active. Okay, cysteine is the most functional site there. Purine and pyrimidines, what do they require? Remember that purines are 2 rings. They have 2 rings. Pyrimidine have a single ring. Okay, pyrimidine have a single ring. So purines are 2 rings. So they require more amino acids as compared to pyrimidines. So purine, imagine like which are the purines? Those are the A and the G. Adenine and guanine, these are the purines, right? And then you have, when you have egg puree, someone who has not had egg anytime has an egg puree gets a gag reflex. Gag aa jayega, vomiting ho jayegi, gag ho jayega. So remember, gag are the amino acids required. You have glutamine, glycine and aspartate. That is GAG. Okay, that is GAG is required for purine. In pyrimidine, we do not require. Pyrimidine एक ही ring है, so 1 amino acid is removed from GAG. The G is removed, that is the glycine is not required. You have glutamine and aspartate. Remember, it is glutamine and aspartate, not aspargine and glutamate. It is glutamine and aspartate which is required for purine and pyrimidine. ठीक है? Next one, coming to glycogen storage disorders, very, very important. So we have seen about the amino acid disorders, very, very important. Phenylketonuria, alkaptonuria, albinism, then you have maple syrup urine disease. A question on this generally comes in the exam very frequently. Okay? Next one, glycogen storage disorders. Glycogen storage disorders, quick points. Type 1 is von Gurkey's. Okay, type 1 is von Gurkey's, and G for G, Gurkey's is glucose 6-phosphatase is the enzyme deficient. So von Gurkey's is glucose 6-phosphatase. Can you tell me, this is a previously asked question, glucose 6-phosphatase is a marker of which cell organelle? Glucose 6-phosphatase is a marker of which cell organelle? It is a marker of endoplasmic reticulum. Okay, it's a marker of endoplasmic reticulum. Very good. So in von Gurkey's, the glucose 6-phosphatase is gone, and this glucose 6-phosphatase, what is it required for? Is it required for glycogenolysis? Is it required for gluconeogenesis? Or this is required for both? Remember, this is required for both. Okay, it's an enzyme required for both. So when glucose 6-phosphatase is not there, that is von Gurkey's, both the glucose production pathway will be affected in the body, and that is why there will be severe fasting hypoglycemia, which will not be responsive even to glucagon challenge test. क्योंकि दोनों नहीं हो पा रहे हैं, glucagon challenge test will not be able to increase the glucose levels. Plus, everywhere the glycogen is deposited, so there is hepatomegaly, there is renomegaly, there is hyperlipidemia, so fat deposited in the cheeks. Imagine like chubby chicks, it is called as doll-like facies. Doll-like facies is another important feature. Plus we have lactic acidosis and hyperuricemia. Okay, these are very, very important features of von Gurkey's. Okay. Yes, Sapna, that was the trick that we had posted on Instagram today itself in the 50-day challenge. Victorious people can always make history today. Okay, so von Gurkey's, Pompey's, Corey's, Anderson's, McArdle's, Hers, and Tarui's. These are the glycogen storage disorders one by one. Victorious people can always make history today. Okay, they can always make history today also. Okay. Then you have type 1b, where there is the transporter defect only. Okay, the transporter defect only. This will have recurrent infections also. Type 2 is Pompey's. Okay, type 2 is Pompey's, victorious people. Pompey's affects the pump in the body, that is the heart. So that is why there will be cardiomegaly and heart failure. Heart requires fatty acid, right? So remember that the enzyme which is defective here is acid maltase, which is also your lysosomal enzyme. So Pompey's is the only one which is the glycogen storage disorder, which is a lysosomal storage disorder. So it is actually alpha glucosidase. Okay, this is alpha glucosidase enzyme. Okay. Next one, type 3, the third alphabet is C. This is Corey's, also called as Forbes or limit dextrinosis. C के बाद आता है D. So Corey's has a defect of a D branching enzyme. Okay, remember here also there is muscle weakness. There is hepatomegaly due to accumulation of branched chain polysaccharide, because the D branching is not happening. So you will see the short branches which will be present. That will lead to hepatomegaly. Type 4, remember when I write 4 and I make it like A, 4 is like A, so that is type 4 is Anderson's disease. Remember, Anderson dies at the son's age. That means death is at 5 years, young age, because of there is liver cirrhosis. Remember, there is cirrhosis in Anderson's. Okay, and here there is a problem with branching. So A के बाद आता है B, C के बाद आता है D. Anderson branching, Corey's D branching. So what happens in Anderson's? You would see long polysaccharide chain without branches that will accumulate. So this will precipitate in the liver and that will cause cirrhosis. So remember, A for A, this is also called as amylopectinosis. because it is like amylopectin, the long chain. Type 5 is the McArdle's, is the muscle glycogen phosphorylase. Hers is the hepatic glycogen phosphorylase. McArdle's muscle, hers hepatic. Okay, these are type 5 and type 6. Muscle is gone, तो exercise में problem आएगा. Exercise induced cramps, muscle breakdown होके rhabdomyolysis, myoglobin होगा तो renal failure होगा. And very important, remember there is a second wind phenomenon. Okay, second wind phenomenon. That means after this, a break in the exercise, the person can exercise again. It's because of the increased cardiac output, the increased blood flow to the muscles. That's a compensatory mechanism. So remember, second wind phenomenon is seen in McArdle's disease. W ka ulta is M. Then you have jo liver wala hai, hepatic, it's a mild hypoglycemia versus von Gerke's, which has severe hypoglycemia. Type 7 is Tyrosine. Remember, when I write T, it has 7 in it. So remember, Tyrosine is 7 and Tyrosine is like tone RBCs. So there is hemolytic anemia in Tyrosine. Whenever the RBCs are affected, the cycle that we are thinking about is glycolysis. So glycolysis wala kaun sa enzyme hota hai? It is phosphofructokinase. So this affects the muscle phosphofructokinase. So exercise wale cramps or hemolytic anemia is what we would see here. So that is phosphofructokinase affected. Okay? So these are the glycogen storage disorders. Have a look at this image, also given in your first aid. So what happens here is, look at the first one. What do you have at the first one? The second is glycogen synthase. This is how the glycogen is formed. Then occurs the branching. Okay, then occurs the branching basically, right? And then what happens? This one which you see, where the glycogen can be degraded, breakdown in the lysosome, this is going to be Pompey's. Okay, this is going to be Pompey's. Then the next that we have, which is glycogen phosphorylase defective, it is a McArdle's, and where you have the short branches which are not able to be removed, this is Cory's. The debranching is affected. Okay, the debranching is affected. Right. Hurlers and Hunters. Remember, these come under Mucopolysaccharidosis. Hurlers, Hunters. Hurlers is L-iduronidase. Hunters is iduronate sulfatase. T and T, L and L. And in both of them, it is heparin sulfate and dermatan sulfate which accumulate. So in Hurlers and Hunters, it is H for H, heparin sulfate and dermatan sulfate accumulate in Hurlers and Hunters. Hunter requires clear eye for hunting. There is no cornea clouding in Hunters. That is an important feature. What is the inheritance of Hunters? What is the inheritance of Hunters? Hunter goes for hunting, taking an axe. Axe is X-linked recessive. The rest of them are autosomal recessive. Okay, the rest of them are autosomal recessive. Please do not confuse this Hunters with Huntington's. Huntington is autosomal dominant. Okay, Huntington is autosomal dominant. Hunters is X-linked recessive. Okay? Next one, lysosomal storage disorders. PDF you would get on the Telegram group, on my Telegram group after the class is over. Okay? Lysosomal storage disorders, quickly having a look at those. So in lysosomal storage, we have Sphingolipidosis, we have the Mucopolysaccharidosis, and we have the Pompey's, right? We said Pompey's is the only glycogen storage disorder which is a lysosomal storage disorder as well. It is acid maltase alpha glucosidase which is deficient. Sphingolipidosis, Gauchers. Okay, coming to Gauchers. Now remember the enzymes glucosidase and galactosidase. How do you remember glucosidase and galactosidase, alpha and beta? Alpha glucosidase, beta glucosidase, alpha galactosidase, beta galactosidase. Okay? So, alpha glucosidase we have already seen is acid maltase wala, which is Pompey's. Beta glucosidase has U in it, Gauchers has U in it. So remember, Gauchers is beta glucosidase, not galactosidase. Alpha galactosidase and beta galactosidase. Alpha is Fabry's and beta is Crab's. Alpha is Fabry's and beta is Crab. So when you have double B in Crab's, that tells you that it is beta. Fabry is single B, that is not beta. और Fabry वाले में बहुत बार आपको options में आएगा. Remember, Fabry is like trihexosyl ceramide is what accumulates in Fabry's. Fabry's is tri. Okay. So Gauchers is U. It is glucocerebrosidase, not galactocerebrosidase, also called as beta glucosidase. Tay-Sachs. When I write Tay-Sachs, the X and the A, this is hexosaminidase A. Fabry's is alpha galactosidase. Crab's is beta galactosidase or galactocerebrosidase. Niemann-Pick is sphingomyelinase. When I write sphingomyelinase, remember the NIP. The NIP helps me to remember it is sphingomyelinase. Very, very important. Now coming to the features of this lysosomal storage disorders, the various sphingolipidosis. Just give me, I wanted to add a blank slide to write down. Just give me a minute. Right. So what do we have is in Gauchers, very, very important and frequently asked. Remember, Gauchers, the patient says, ouch, ouch. Ouch, ouch, because the patient is in a lot of pain. Bone pain is a bad pain. There is bone pain because the Gauchers goes into the bone marrow. So that leads to pancytopenia. There can be anemia. There is pancytopenia. Okay. And when the patient is crying with the bone pain, you give the tissue paper to wipe the tears. So remember, it has crumpled or wrinkled tissue paper appearance. That is Gauchers. It has that Erlenmeyer flask deformity of the femur is what we see. Next that we have is Niemann-Pick's. What do we have in Niemann-Pick's and Tay-Sachs? So NP and Tay-Sachs, two-word wale sphingolipidosis. They have two-word wala defect, that is the cherry red spot. Niemann-Pick is big. Pick is big. So there is big organs, hepatosplenomegaly present. Tay-Sachs is T, tiny organs. There is no hepatosplenomegaly. So cherry red with hepatosplenomegaly NP, cherry red without hepatosplenomegaly, it is Tay-Sachs. And in Tay-Sachs, we have a very important feature, that is exaggerated startle reflex in a child because of hyperacusis. Okay, because of hyperacusis, we have the exaggerated startle reflex in Tay-Sachs. Also remember in Tay-Sachs, sac of onion ka bora, onion ka pota, it has onion peel appearance of the lysosomes on electron microscopy. And Tay-Sachs is what? Gangliosidosis. Is it GM1? Is it GM2? Is it GM3? What gangliosidosis is Tay-Sachs? Remember T for 2, it is GM2 gangliosidosis. Again, a previously asked question, right? And the next one that we have in Niemann-Pick's, what do we see in the Niemann-Pick's? What are the findings? What are the bodies that we see in Niemann-Pick's? What are the findings? What do we see in the Niemann-Pick's? So remember, is like Niemann-Pick's is like no man. Okay. So Niemann-Pick's is like no man while crossing the zebra crossing. No man while crossing the zebra crossing should pick the nose with finger. Okay, that is Niemann-Pick with finger. That is finger. That is sphingomyelinase, because then there can be foam coming out from the nose, right? The foam coming out. So we have the foam cells and we have the zebra bodies and foam cells in Niemann-Pick's. Okay, that is Niemann-Pick's. So Gauchers, Niemann-Pick's, Tay-Sachs. Next is Fabry's. So remember, Fabry is like fabric. Okay, Fabry is like fabric. What color fabric it is? The violet, the pink color fabric is what we have. It has those multiple dots here. What do the dots represent? The skin lesions, angiokeratomas. Okay, angiokeratomas. Fabry is like fabrics. So remember, it is X-linked recessive. The Sphingolipidosis, which is X-linked recessive, is Fabry's. So imagine you are going by a road and a shopkeeper comes behind you telling, ma'am, please take this cloth. This is very, very good cloth. If you wear this cloth, it will decrease your sweating. So there is decreased sweating is a feature of Fabry's. There is hypohidrosis, decreased sweating. Okay. And there is early, again, there is increased risk of all the organ involvement. There is stroke, there can be MI, it can affect the kidney, it can lead to nephrotic syndrome. Nephrotic syndrome. And that is why, what do you see in the urine? Maltese cross appearance. Remember, Fabry's has Maltese cross appearance in the urine. Previous INI-CT question. Okay, previous INI-CT question. So that is the story of Fabry's. Okay, that is the story of Fabry's. So majority are done. The next that is remaining is crabs. What do we have in crabs? Remember that crabs are extinct from the earth. That means in crabs, the myelin is extinct. There is total demyelination happening. Extinct myelin is what is happening. So even the optic nerve myelin gets affected. So there is optic atrophy. There can be optic nerve thickening because of the deposits. Plus bilateral thalamic hyperdensities is what we see radiologically, right? So crab is extinct from the globe. That means it is globoid bodies is what we see in crabs. So remember, crab is extinct from the globe, globoid bodies, extinct myelin, optic atrophy, and bilateral thalamic hyperdensities is what we see with crabs. Okay. So everybody is clear with the sphingolipidosis, the keywords that will help you to identify. Fabry's is X-linked recessive. Hunter's is X-linked recessive. G6PD deficiency is X-linked recessive. Leishmanian is X-linked recessive. Okay, very, very important. Next one, I think we'll do this last one, the table here. For hormone sensitive versus lipoprotein lipase. Okay. So what do we have here? Hormone sensitive lipase, lipoprotein lipase. Which is catabolic, which is anabolic out of these? Which is catabolic or which is anabolic out of these? Lipoprotein lipase. Lipoprotein lipase is anabolic and hormone sensitive lipase is catabolic. So if I say that lipoprotein lipase is anabolic, right, then it is stimulated by which hormone? Insulin will activate or insulin will block lipoprotein lipase. Right, so insulin is an anabolic hormone. Khane ke baad, meals ke baad insulin increases. So anabolic, it will increase the stores in the body. So this will be stimulated by insulin. Okay, this will be stimulated by insulin. Lipoprotein lipase. Okay? So it is anabolic and remember it is stimulated by insulin. Hormone sensitive lipase basically causes the breakdown of the adipose in the body, lipolysis. So it will be stimulated by catecholamines by glucagon. So look at this one. Hormone sensitive lipase present in the adipose site and it hydrolyzes the triacylglycerol in the adipose. So basically this is catabolic. So this will be active in the fasting state when we are not eating from outside, that is glucagon. Lipoprotein lipase is present in the capillaries. It hydrolyzes the triacylglycerol in the lipoproteins. Which lipoproteins? Which contain maximum triacylglycerol, that is chylomicrons and VLDL, and it is active in the fed state, that is it is activated by insulin. So very, very important, remember that insulin activates the lipoprotein lipase. So therefore in diabetic patients who have decreased insulin, right, so there would be decreased activity of lipoprotein lipase. So therefore, the VLDL levels increase in diabetes because the lipoprotein lipase is not activated. So the VLDL is not broken down. So remember, the VLDL levels increase. Okay? Is this clear with everyone? Right, hypertriglyceridemia is what we see because VLDL have triglycerides, maximum triglycerides. Okay, so we will take a pause here for today, and we will continue with the rest of the biochemistry tricks and the revision tomorrow. I hope everybody, each one of you, were able to recollect it. Went a bit fast because we don't have much of time to go, like, aram se and go into all the details, right? I'll share the PDF on the Telegram group, Dr. Nikita's Rat Synapse, and I would see you again tomorrow, guys. A lot of sessions. सबसे पहले 8:30 बजे radiology plus course PYQs. फिर 10 a.m. it's going to be the radiology marathon, and then we have the 6 p.m. KBMD, basically to help you with the PSM numericals. This is a free class, and then 9:30 p.m. we will have the rest of the biochemistry ka class. Okay, thank you so much, everyone. Good night, take care, and keep studying, keep revising, and keep winning. Thank you.